Technology plays a huge part on our lives. It is almost impossible to go a day without some interaction with technology. With easy access to computers, the digital divide has been decreasing. According to the United States Census Bureau, in 2013, 83.3% of all households own a computer. Another study was done to measure computer usage in employees and college students. The average number of hours employees spend using a computer in a workplace per day is 7 hours, according to Microsoft. The average number of hours college students use a computer per day is 12 hours. Computers revolve around our daily lives, yet most people don't know the risks after prolonged use. 85% of work employees and 54% of college students who use a computer experience symptoms of computer vision syndrome, CVS. CVS is affecting people of all age groups in several different environments. In the office, in colleges, and school, and at home. But what exactly is CVS? How does a person know they have acquired it? The easiest way to determine if you have CVS is if you are suffering from any of the following symptoms: eye strain, headaches, blurred vision, dry eyes, neck and shoulder pain. Now, to be a little more scientific, CVS symptoms are broken down into 4 main categories. Asthenic, referring to eye strain, tired eyes, and sore eyes. Ocular surface related, referring to watery, irritation, and dry eyes. Visual, referring to blurred vision, slowness of focus change, and double vision. Extraocular, referring to neck pain, backache, and shoulder pain. There have been several recent studies that have been conducted to prove just how prominent CVS is. In one study of 416 engineering and medical students, 80% of the students complained of any of the symptoms of CVS while working on the computer. As you can see by this graph, this was a study conducted from 5 universities in Malaysia with a total of 795 students between the ages of 18 and 25. The prevalence of one or more symptoms of CVS was found to be 90%. The results also state that most disturbing symptoms was headache, 19.7%, followed by eye strain, 16.4%. Many of you are probably wondering what causes this CVS we have been talking about. Well, symptoms could be caused by a lot of things like poor lighting, glare on a digital screen, improper viewing distances, poor seating posture, uncorrected vision problems, or a combination of all of these factors. Although there are many different ways to cure CVS, and depending on who you ask, you will most likely get a different answer every time as to which remedy works the best. From our research, we can conclude that some of the best and most effective methods of helping to prevent and relieve eye strain are rather simple. The first step into relieving CVS is to prevent it before it starts by getting a comprehensive eye exam. Having a doctor annually check your vision is the most important step one can take to prevent CVS. Having a doctor test your vision at your specifically working distance allows one to drastically reduce their chance of having CVS. In addition to getting a doctor's recommendation, using the proper lighting can have immediate effects as well. Many computer users find that working under overhead fluorescent lights is not ideal, but instead to use full spectrum fluorescent lights that mimic the light of the sun, which ultimately relieves CVS. Minimizing glare in the workplace and lowering the brightness setting on the display monitor also helps. One of the easiest ways to accomplish both of these problems easily is to upgrade your display monitor. New liquid crystal display monitors are much easier on the eyes compared to the old cathode ray tube displays and are often come built with settings to help prevent eye strain. The eye's most effective method of replenishing the fluids that lubricate the eye is to blink. The more often someone with CVS blinks, the more hydration the eye will receive, which ultimately leads to relief. While your eyelids have the ability to hydrate your eyes, you can exercise your eyes to help keep them focused. Taking a quick break from looking at your computer to stare at an object that is over 20 feet away will help you exercise the muscles that attach to the eyeball. Strengthening eyeball muscles is a great way to gain the ability to focus for extended periods of time. This is more commonly known as 20-20-20 rule. Every 20 minutes and 20 feet away for 20 seconds. The last and most beneficial method for CVS relief is to consult your doctor, to possibly having your prescription modified, or even to have a custom pair of computer eyeglasses made for work. This method is very commonly practiced in people that wear contacts, which become dry or uncomfortable after extended use. We would like to thank you for listening to us today. Hopefully you are now properly educated on how to prevent CVS in our lives and also how to prevent it. Thank you.